Okay, so first things first, let's get one thing straight because it's a super common mix-up. We're not talking about pharmacy today. The essential job of actually preparing and handing you your medicine. Nope, we're going deep into pharmacology. That's the science, the nitty-gritty of how those drugs actually talk to your body on a molecular level. The best way to wrap your head around this whole thing, think of it like a conversation. Seriously, it's a two-way street. Your body does stuff to the drug, and then the drug does stuff right back to your body. Understanding this back and forth, well, that's the key to everything. And this conversation, it really has two main sides to it. On one side, you've got pharmacokinetics, we'll just call it PK, which is basically the story of what your body does to the drug. Then on the other side, there's pharmacodynamics, or PD. And that's what the drug does to your body. So let's break down both sides of this chat. All right, let's kick things off with pharmacokinetics, or PK. I love this way of thinking about it. It's like the drug's epic journey through your system. So what is pharmacokinetics? Simply put, it's the drug's travel itinerary. It's the whole story, how your body pulls it in, where it sends it, how it gets broken down or changed, and then, finally, how it gets kicked out. It's the full life story of that drug inside you. Now, pharmacologists have this handy little acronym to map out the journey. ADME. It starts with A for absorption, getting into your system, then D for distribution, traveling to where it needs to go. Next is M for metabolism, where your body chemically tweaks the drug, and finally E for excretion, which is just how it leaves your body. That four-step roadmap, that's the complete life cycle of a drug. Okay, so the drug has taken its journey. It's arrived at its destination. But now what? What's its actual mission? And that brings us to the other half of the conversation, pharmacodynamics. Pharmacodynamics, or PD, is all about the drug's effect. If PK was the journey, think of PD as the purpose of that journey. This is how the drug actually carries out its specific job to make a change in your body. So how does a drug actually do anything? Well, when you get down to the cellular level, it often boils down to this really simple, elegant idea. Most drugs act like a key that's been made for a very specific lock. And in science, we call that lock a receptor. And these keys, they basically work in two main ways. You've got an agonist, which is the key that fits the lock and turns it. It kicks off a process, kind of like flipping a light switch to on. Then you have an antagonist. Now this key also fits, but instead of turning, it just jams the lock. It blocks it so nothing else can use it. So really, most drugs are just turning things on or shutting things off. Okay, so we've got the drug's journey, the PK, and we've got its mission, the PD. But how does all this science actually become a safe and effective medicine for you and me, for the patients? There's this fantastic quote from Paracelsus, who was a pioneer in this field, and it just nails the whole challenge. The right dose differentiates a poison from a remedy. It's so simple but so true. The only thing separating a medicine from a poison is how much you take. And this is the huge challenge for anyone developing a new drug. They have to find what's called the therapeutic window. See, if you have too little of a drug, it just doesn't do anything. It's ineffective. But if you have too much, it can become dangerous, even toxic. The entire goal is to dose it perfectly right in that sweet spot where it works and it's safe. And let me tell you, getting this right is incredibly, incredibly hard. Just think about this for a second. More than 95% of drugs that look amazing in a lab will ultimately fail when they get to human clinical trials. That's a staggering number. And why? Well, a lot of the time, it's because their journey or their effects, their PK or PD, just don't work out the way we expect in our super complex bodies. So all this science has some really practical, real-world consequences. It's what helps your doctor choose the best way to give you a medicine. A pill you take at home, that gives a slow, steady absorption. But in a hospital, in an emergency where every single second counts, they're going to use an IV to get that drug working immediately, right into the bloodstream. It's all about matching the science to the specific situation. So let's bring this all back home. We've covered a ton of science here, but it really all comes back to that conversation we talked about, the one happening right now inside your body. Really,
when you boil it all down, that's what pharmacology is. It's the science of understanding this dialogue. The medicine speaks, and your body listens and talks back. Your body speaks, and it shapes the entire journey of that medicine.
So why should any of this matter to you? Well, because understanding this conversation is what makes sure your medicine is actually effective. It's what keeps you safe. It's what helps doctors personalize your treatment just for you. It helps prevent dangerous drug interactions. And, bigger picture, it's the engine that literally drives the entire future of medicine.
And that leaves us with one last big idea to chew on. As we get better and better at listening in on this super intricate conversation, the future of medicine is becoming more and more personal.